Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative Orthopedics and Sports Medicine.
Well, today we are at Regenerative Orthopedics and Sports Medicine at one of their many locations across the DMV. Maybe you are in pain, maybe you have arthritis, and maybe surgery is on the table. There are other options. Today we're with Dr. John Ferrell of ROSM, the managing partner and co-founder. So tell us a little bit about options for patients that are in pain, because, you know, a lot of times you think surgery is the only option, but apparently not.
No, yeah, so when we talk about the mission at ROSM, we're talking about redefining orthopedics and sports medicine, right? When we look at the way that orthopedics has been practiced historically, we start off at the top of the food chain. So if you roll your ankle and you know there's nothing surgical, why do you start off with the orthopedic surgeon, right? If you get chest pain, you don't start off with a cardiothoracic surgeon, you're gonna start off with a cardiologist. So we are the non-surgical branch of orthopedics. So we're able to give them different options that typically aren't presented for them. We have more research coming out showing that cortisone is detrimental, and a lot of people are getting cortisone shots left and right. And we find out that study after study shows it can deteriorate the joint, cause small tears to get larger, and it's really not a great long-term option.
Yeah, so again, why don't you explain a little bit the difference between regenerative orthopedics and traditional orthopedic surgery?
Absolutely, so we're gonna be a lot more conservative. We tend to spend a lot more time with the patients. And we use things like musculoskeletal ultrasound that allows us to see soft tissue instead of just bone on x-ray in order to heal things, repair, and to follow it over time. And so we have a lot of non-surgical injections that can be healing, reparative, or at least calm down inflammation without causing detriment or damage like cortisone.
Yeah, so talk about the patient experience and the outcome that some of your patients have experienced.
Absolutely. So the patient experience, we usually spend 30 minutes with our patient. It gives us plenty of time to get a great history, do a great physical exam, use the musculoskeletal ultrasound to scan the area of pathology, and then we can talk about treatment options, and we even have enough time to actually start a treatment the very first visit if needed. And this allows us to then, over time, allow them to come back, and let's say if they have a tear in their rotator cuff, we do a treatment, 6 weeks later, we can rescan it, see evidence of healing over time. So not only do you feel better, you can actually see the improvement.
And what's amazing is they do work with insurance. So that is always, I think, kind of top of mind when anybody's looking for a provider. You talk a little bit about a treatment gap here. Can you talk more about that?
Absolutely. The treatment gap is that time between when people have tried conservative options like physical therapy or chiropractic care and before they're ready to move on to a major surgery. And so we find that a lot of people are in a treatment gap for about 2 to 9 years. And so this is a time when they start to gain weight, they start to not live a healthy lifestyle because they're in pain and they can't be active. Those are perfect patients for us because we have different injections and options that can help to get them out of pain so they can live a healthier, happier life.
You know, it's life-changing. You are giving people back that time. Let's talk a little bit about some of the procedures that you offer here at your offices.
Absolutely. So we do things like prolotherapy, which is injecting dextrose and lidocaine into an area to create an irritation, to trick your body into thinking that a new injury had occurred, so your body wants to try to heal or get that better with its own stem cells. The next step up from that is to use platelet-rich plasma, where we use your own blood, we spin it down in a centrifuge, we get rid of the red and white blood cells, but we keep the platelets. These platelets contain growth factors that serve as a magnet or a beacon to tell stem cells where to come, and they start to heal and repair areas of pathology. And then our strongest option is to use bone marrow or microfragmented adipose. Both of these contain mesenchymal stem cells. So these serve as a reparative, cushioning area to help decrease inflammation, but also to repair areas that are injured.
I feel like you are giving so many of our viewers hope right now. You heard the phones. If you want to maybe get a consultation, look at some other options, make sure that you connect with Regenerative Orthopedics and Sports Medicine. All of the information is on your screen. And again, they've got locations across the DMV, 6 locations to be exact. So give us a call right now. Thank you so much, Dr. John
Thanks
Ferrell.
for being here.